4 years ago, we're in the throes of a newly diagnosed child with cancer, and we didn't know a lot, but we knew that we needed social support. We knew that we needed a community, and we didn't have it. So that's what we did. We started MaxLove Project to give back, build a community.
So parents get the diagnosis, and then they get a treatment plan. And it is a very disempowering space for most parents to be in. They're told, your child has a terrible disease, and now all you need to do is follow these instructions. Now when we go home, we're saying, well, there's nothing left for us to do. But we dove into the research, we started to connect with other nonprofits, we started to find out what else was out there, and we found that there were a bunch of things that we could do as parents, the things that we fed Max, the way that he sleeps, managing his stress, making sure he gets a lot of physical activity. These were all things that we could do, and then we started to talk with other parents who were in our situation. Then we found out, wow, we're really onto something here.
The mission of MaxLove Project is to help families facing childhood cancers thrive in treatment and beyond using evidence-based whole body wellness strategies and nutrition. So I think what we really realized was maybe this isn't the space of what the hospital needs to do or what they need to do in critical care, but it's the space of what we need to do. It's a space of opportunity for us to step up as parents and say, this is what we can provide for each other. And so MaxLove Project was born in the space of voids, the voids in pediatric healthcare. That's where we've come from, is seeing the opportunity to do more, using a wide range of programs from our Fierce Foods Academy monthly cooking classes. We support cancer research. We have an amazing online support group of over 720 families now. We have great one-on-one, fully funded dietitian consultations. We have an amazing broth bank. We have Camp Make and Believe, our therapeutic arts program. We have Ethan and Chaco's book club.
Thrive sessions, sleep aids, well kits, that's just the tip of the iceberg.
One of the things that we want to do is empower our families around the country and around the world to make their own MaxLove Project. Ideally, what we would see is families taking our educational materials and resources into their own hands, starting their own social support group in their community, and building that physically there. What we'd like is to see more health and care put into healthcare.
So one of our biggest campaigns is to build a teaching kitchen dedicated to fierce foods, dedicated to families fighting cancer. We are on the right path here in Orange County, but our goal is to build one next to every children's hospital so that when families are in the hospital or when they're in outpatient, that they have a place to come and experiment, to introduce new foods, and to learn about the healing power of food.
But then also be a training site for our physicians, to be a training site for our community's teachers, to be a place where our entire community will really gain the skills to thrive, because as our community thrives, our kids thrive.